Welcome. I am Marcy Lawing, the nurse educator here at TriageLogic. In this video course, we will go over steps 3, 4, and 5 in our series on the critical steps in taking a triage call. Please be sure and review our previous course, which covered steps 1 and 2 before continuing. All triage nurses should be using protocols to help guide them through the process. It is important not to miss or skip any of the steps along the way. While protocols are important to keep the nurse focused and on track, they should also be supported by the information the nurse collects, the past medical history, and her documentation. We are now going to take a look at the next 3 parts of taking a triage call. Number 1, collecting a brief past medical history. Number 2, letting the patient talk. And number 3, documenting a brief yet complete assessment. The past medical history adds a layer of additional clinical information to help nurses make sure their patients are getting to the safest level of care. It can add a layer of depth to their assessment and fine-tune their outcome, a sort of safeguard, if you will, that the patient is getting to the safest level of care. This information should be collected early in the triage process. The purpose is to help the nurse make a decision about which disposition and plan of care is most appropriate for her call. To better illustrate how important an accurate past medical history can be to the outcome of a call, let me tell you about Alexis. Alexis's mother is calling tonight. She's concerned that Alexis developed a fever that afternoon. Mom reports her temperature at this time is 101 rectally, and there are no other symptoms. Alexis is eating and drinking well, is wetting diapers, and her breathing is normal. She's a little cranky, but it's almost her bedtime, so that's normal behavior for her. If the nurse did not ask about past medical history, one could assume home care advice would be appropriate. Alexis does have medical history, though. She was born with renal reflux and a short urethra. The doctor had explained to Alexis's mom that if she developed a fever without any reason, such as no exposure to illness or the absence of any other symptoms, that she would need to be seen in the emergency department immediately. If the nurse had not asked about Alexis's past medical history, and the mother assumed that the nurse could see Alexis's record, this bit of information could have easily been missed, resulting in a potential delay of care and serious complications for Alexis. When collecting past medical history, at a minimum, the nurse should ask about chronic health problems, medications the patient takes daily, and any allergies to medications and/or foods. To illustrate the importance of talk time, let's take the 75-year-old male caller who's not used to calling a triage nurse for any kind of assistance. He's very stoic, and he's not very forthcoming with his health history. He's a pretty poor historian when it comes to what medications he's on also. This creates a huge challenge for a triage nurse. The nurse lets him talk and finds out he found this number on his discharge instructions, and it said to call if he had any chest pain following his stent, which the nurse finds out was only 2 days ago. She lets him talk and is able to determine that he sounds moderately short of breath and winces when he changes positions. He says he is all alone and that his wife went to the store, but she'll be home within the hour. The nurse now has enough information to start her assessment. Improving your active listening takes practice. Set a goal of learning the patient's most serious symptom by 1 minute or sooner into your phone call. Finally, let's talk about documentation. All nurses can finish this statement. If it wasn't documented, that's right, it wasn't done. Good documentation will tell the patient's current story and can stand alone if questioned. It should paint a picture of the patient's current health concern. Good documentation clarifies inconsistencies and verifies that the nurse is using the most appropriate protocol to assess her patient. Here's an example. If I wrote, quote, "patient is coughing," unquote, would you have enough information to choose a protocol? Probably not. You'd need more information. If the patient's coughing because of a cold, Has he been diagnosed with bronchitis or pneumonia? Perhaps he's choked on a foreign body or was exposed to a chemical that is causing his symptoms. Each of these reasons would prompt the triage nurse to follow a different protocol in order to get her patient to the safest place. Here are a few more things about documentation. While it should be complete, it is important to keep your notes brief. Brief, concise but thorough, and should contain the pertinent negatives and or positives. Documenting the pertinent negatives does two things. It shows the reader that the triage nurse took the time to fully assess her patient and has used her critical thinking skills to rule out emergent conditions that could be associated with the injury or patient's symptoms. For example, if you had a child that fell and hit his head, you would want to document the basics: when it happened, where the injury was, what the child was doing, the extent of the injury, but you would also want to add any pertinent negatives such as no loss of consciousness, child is alert and oriented, child responds to parent, moving all extremities normally, and there's no vomiting. The same applies for pertinent positives. Let's say your caller complains of a fever. By documenting no other symptoms present, the nurse has told the reader that she has ruled out the possibility of other symptoms and is using her critical thinking skills to make sure she is in the correct protocol to assess her patient safely. Now it's time to put your newfound information to practice. The next time you talk to a patient, be sure to ask about any pertinent history. Take the time to listen, even if that means stopping typing and focusing on what is being said. Lastly, be sure to include an accurate description of why your patient is calling, including those pertinent positives and or negatives. Don't forget to check back soon for the next part of our series when we'll talk about choosing the right protocol and getting your patient to the right level of care.